Okay, it is 11:02, so we are going to go ahead and get started. Good morning, everyone. Today we are here to discuss the upcoming implementation of the age 26 through 49 adult expansion on January 1st, 2024. Just some housekeeping details. Q&A, please direct all comments and questions to the Q&A. A Q&A log will be provided to participants for any questions not addressed during the webinar. The slide deck will be provided to all participants by an email after the webinar. The slide deck and an English recording will also be posted on the Adult Expansion webpage. Today, we are live interpreting this webinar in Spanish. So I am going to go a little bit slower and have some pauses here and there just to allow for our interpreter. Okay, so we have an overview here. The adult expansion is designed to extend full-scope Medi-Cal benefits to California residents aged 26 through 49, irrespective of their immigration status. They must meet all other Medi-Cal eligibility criteria, such as California residency and household income limits. With this expansion, we are taking a significant leap towards universal health care access in California. The governor's 2022-2023 budget projects the adult expansion to significantly impact the immigrant population. That estimate stands at 707,000 individuals who would benefit from this initiative. So moving on to the legislative aspect that has made all this possible. Senate Bill 184, enacted as Chapter 47 of the Statutes of 2022, amends the Welfare and Institutions Code Section 14007.8. This significant amendment expands the eligibility for full-scope Medi-Cal services. Beginning on January 1st, individuals who are 26 through 49 years of age and do not have satisfactory immigration status as required by Welfare and Institutions Code Section 14011.2, can qualify for full Medi-Cal benefits. Of course, this is contingent upon them meeting all other eligibility criteria. And this legislative act is the cornerstone of our age 26 through 49 adult expansion plan and symbolizes California's commitment to inclusivity and universal health care access. So now let's break down our target populations for the expansion. We have two key groups. The first is the new enrollee population. These are individuals who are 26 through 49 years of age as of January 2024, not currently enrolled in Medi-Cal. If they apply for Medi-Cal starting January 1 and meet all eligibility criteria for full-scope Medi-Cal except for satisfactory immigration status, they will qualify for full benefits under this expansion. The second group is the transition population. This encompasses individuals who are 26 through 49 years of age and are currently enrolled in restricted scope Medi-Cal because they lack a satisfactory immigration status or are unable to establish satisfactory immigration status for full scope Medi-Cal. These individuals will be transitioned to full-scope Medi-Cal under this new initiative. These two groups represent the direct beneficiaries of the adult expansion plan. Our goal is to ensure that these populations have seamless access to comprehensive healthcare services, irrespective of immigration status. So to facilitate this significant expansion, we devised a systematic transition process. And let's discuss that timeline and the key steps involved. So the adult expansion transition population in restricted scope aid codes will be shifted into corresponding full scope aid codes for the January 2024 month of eligibility. Beginning on November 21st and continuing through November 30th, CalSAWS executed transitioning batches. Following this, from December 1st through December 5th, the Department of Healthcare Services will process transitioning batches for those individuals who could not successfully transition to full scope by the CalSAWS batches. This planned phased approach ensures a smooth and systematic transition, minimizing potential disruptions and ensuring that every eligible individual provided full scope Medi-Cal is provided full scope Medi-Cal for the January 2024 month of eligibility. In terms of aid codes, I want to clarify that there are no new aid codes introduced for the age 26 through 49 adult expansion. Instead, eligible individuals under this expansion will be allocated to existing full scope MAGI and non-MAGI Medi-Cal aid codes. The department has meticulously developed an aid code crosswalk. This is a strategic initiative designed to identify the appropriate full scope aid code for those eligible individuals who are currently in restricted scope aid codes. This crosswalk serves as a guide to smoothly transition individuals into full scope coverage. This approach is in line with our ongoing commitment to ensure that everyone who is eligible gets the comprehensive health care they are entitled to. So retroactive Medi-Cal. Medi-Cal includes provisions for retroactive coverage. Medi-Cal applicants can request retroactive coverage for up to 3 months prior to their application month. Under the adult expansion, full scope retroactive coverage will be available from January 2024 onward. Adult expansion individuals who request retroactive coverage for any months prior to the implementation month will be granted restricted scope Medi-Cal based on eligibility policies that were in effect prior to the expansion. So for example, if someone applies in January and requests retroactive coverage, they would receive restricted scope retro benefits for October, November, and December 2023, and then their full scope benefits would begin in January 2024. Also, if someone applies in February and requests the retroactive coverage, they would receive full scope retroactive benefits for January 2023, and then those restricted scope retro benefits for November and December 2023. And so applying for or using Medi-Cal does not impact an individual's immigration status. The U.S. Department of Homeland Security and U.S. Citizenship and Immigration Services do not consider health, food, or housing services as factors in the public charge determination. By incorporating this vital messaging into our outreach materials, the department is emphasizing California's commitment to ensuring access to health care for all, regardless of immigration status. This messaging aims to dispel any lingering fears or misconceptions, promoting greater participation in Medi-Cal's comprehensive healthcare services. The department has been proactive in keeping our providers and managed care plans in the loop with the latest updates and developments regarding the adult expansion. As part of this commitment, we've published an October provider bulletin on the Medi-Cal provider website. We also posted a news flash in November, and another one will be posted in December, ensuring that everyone is kept fully informed and prepared for these changes. Furthermore, we are making use of our existing stakeholder engagement forums to discuss and provide detailed updates about the expansion implementation. These platforms include the age 26 through 49 adult expansion stakeholder work group, which provides an open, transparent platform for discussion and feedback. Similarly, the consumer-focused stakeholder work group is another critical platform where we focus on consumer-related issues and concerns. We also maintain active participation in the County Welfare Directors Association of California meetings. In addition to these, we communicate through managed care operation plan conference calls and Medi-Cal dental advisory committee meetings. Each of these channels allows us to maintain open lines of communication, ensuring a smoother transition for all involved as we proceed with the implementation of the adult expansion. So noticing, transitioning our population into the adult expansion is a significant and careful process. To ensure a smooth process, we have developed a comprehensive communication strategy. This includes informing our transition population about what to expect through a series of notices. So we have the first notice, also known as the general information notice. This was sent out to introduce the changes that are coming with the adult expansion. The notice provides an overview of what the expansion entails and how it may affect our transition population. This notice was sent out by DHCS on October 31st. Those who apply after October 31st and up until December 31st will receive this notice from the county with their application materials. We also developed a frequently asked questions or an FAQ document that was sent with the first notice. The FAQ addresses common questions and concerns, providing clear and concise information. And we have a second notice. This is referred to as the notice of action snippets. This is sent to both our transition population and new enrollees to notify them of their transition to full scope Medi-Cal for the January 2024 month of eligibility. The third notice, we call this the managed care enrollment notice, will also be sent to our transition population. This notice will provide further details on their enrollment into a managed care plan under the adult expansion. And then here I just inserted the first notice and the FAQ in English. These documents are available on the adult expansion webpage in all threshold languages. So next up, we have managed care enrollment, and I'm going to hand it over to Angelique.
Thank you, Jill. So I'm going to, excuse me, I apologize for my voice. I'm getting over being sick. So I'm here to discuss with you the managed care enrollment notices. So Medi-Cal Healthcare Options mailed the managed care enrollment notices on November 28th for an in-hand date of December 1st. The notices included a link to the FAQ that is posted on the DHCS website, as Jill mentioned. A written copy of the FAQ will be mailed to members upon request, and the notices direct members to call Healthcare Options if they would like to receive a written copy of the FAQ. The notices explain what a Medi-Cal health plan is and differentiate depending on whether the person is in a COS or single plan county or a non-COS / non-single plan county. If a member lives in a single plan county or a county that has a county organized health system, they will be enrolled in the COS plan, single local initiative plan, or Kaiser Permanente. If the member's county has more than one Medi-Cal managed care plan, they will get information on how to choose a new plan. Enrollments into COS and single plan managed care plans will be automatic and take effect on January 1st, 2024. In non-COS / non-single plan counties, members have Medi-Cal health plan options and will receive a choice packet, which they will use to select their health plan. Members can choose an MCP as early as January month of enrollment. The default enrollment date is February 1st of 2024 if the member does not make a plan choice. Medi-Cal Healthcare Options began mailing the Medi-Cal choice packets to the transitioning population in non-COS / non-single plan counties on November 21st, and this will continue through December 6th. In non-COS / non-single plan counties, members have a choice as to what managed care plan they will enroll in. Members will receive choice packets. Individuals who do not make a plan selection by the date listed in their My Medi-Cal choice packet will be enrolled into the Medi-Cal managed care plan listed in the notice effective February 1st of 2024. DHCS will default assign members in a family to the same plan unless beneficiaries in the household affirmatively choose otherwise. Finally, the choice packets include an enrollment choice form, a self-addressed stamped envelope to return the completed form, a Medi-Cal managed care plan enrollment choice booklet that provides plan information, guidance on how to enroll in a Medi-Cal managed care plan or change plans, the healthcare option presentation schedule, a summary list of Medi-Cal managed care plan benefits, instructions and forms for the medical exemption request / waiver, and a Medi-Cal managed care plan provider directory for their county if applicable. And now I will pass it back over to Jill. Thank you.
Thank you, Angelique. So next up, we have outreach, and I'm actually going to pass it over to Bonnie Tran.
Hello, my name is Bonnie Tran with the Department of Healthcare Services, and I will go over the outreach. So DHCS has developed a comprehensive global outreach toolkit. We strongly encourage counties and our partners to make use of the toolkit's messaging and using it in outreach and social media campaigns. This toolkit is not just a resource, but a shared language which facilitates effective and efficient communication. We are sharing the global outreach language with a broad audience, which includes Medi-Cal managed care plans, other state departments, Medi-Cal providers, and community partners. We believe this resource will greatly enhance any of the outreach activities. So we have launched a new .gov landing page that's available in English and Spanish. These pages hold information on both how to get Medi-Cal or how to keep Medi-Cal coverage. And on this landing page, Medi-Cal members can easily navigate through the options in order to get the help that they need. This is our Keep Your Community Covered Resources Hub. This hub is a one-stop shop to download and share the latest communication resources that we have available. All of the resources that you find on this page is based on feedback from navigators, as well as DHCS coverage ambassadors and community partners. We are updating this hub regularly, and all the resources are available in all 19 threshold languages. And there are sections on this page for each language and tabs for all of the different types of resources. And these are resources for direct outreach. These are the different types of materials that are available for direct outreach. We have created key messages that you can use in your communications. There are videos to download or you can share it. We also have flyers that you can customize and print or post on your platforms. There are call scripts available, email, website, and social media graphics. And these are the general messaging resources that we have available. These messages you can use on your website landing pages. You can use them in call centers, emails, and more. And the messaging includes how to apply, renewal process, updating contact information, and more. And these are some of the social media graphics that are available on the social media graphics tab on the Resources Hub. You can click and share directly these posts to your channels. You can also download the graphics along with the Word document that shows each graphic with its accompanying post copy. And I just want to note that the sharing function is only operational for English and Spanish. And this is to avoid translations losing integrity when it's shared in languages that do not use the Latin alphabet. Print materials. So these are examples of the different print materials that we have that you can customize and use. These are all available in all of the languages. You can add your own organization logos as well as put your contact information such as address, phone number, and website address on here. And you can save that and share it on your platforms, or you can print it out and have it available for Medi-Cal members. And these are some of the videos that we have are available. These are detailed videos as well as short videos available for download and or for sharing. They are all available in the 19 languages. Some of these videos have been used in advertising. You can either download these videos from the Resources Hub or you can share it to your platforms. Some of these are also available on our YouTube channels where you can share. And we also included an SRT file, which is the closed captioning file. So if you need to upload it to your YouTube, we do have the closed captioning file available. And these are our media outreach resources. The Resource Hub has resources to support outreach through local media. There are pitch and radio readers, and there are scripts for radio personalities to read on air. You can use this pitch to send the radio reader with local press to ask them to talk about renewals on air. We also have Mat Release, which is a pre-written article about renewals for use in community newspapers or websites or newsletters. And all of these media outreach resources are available in all of the languages. Tailored audience resources. So there are several tabs on the Resources Hub that are specific for different populations. and for use by our outreach partners. These include in-home supportive services, managed care plans, providers, schools and families, pregnant individuals, and individuals without satisfactory immigration status, and older Americans. All of these resources include key messages, FAQs, and at least one customizable flyer. And we also have at least one social media graphic for all of these different tailored audiences. Outreach campaign. So this is the timeline for our outreach campaign. We started with the focus on awareness, and this is what we started in the beginning of this year. We then move on to a focus on awareness. And so now we're focused on renewals, and we're focusing on expanded eligibility, which includes direct outreach and ad campaigns. Targeted advertising. So the paid media that we have runs from November 2023 through May 2024. There's an emphasis in counties and zip codes with large non-citizen population. We layer on language targeting to reach English as a second language audience. And we're focusing on mobile devices. We're also focusing on out-of-home placement. So there's select Hispanic and Latino, as well as AAPI grocery locations, as well as rural and agricultural locations. And the digital and print ads connect people to the expansion landing page. Earned media. So these are some of the examples of earned media. We have the MAT releases in English and Spanish. We also have audio news releases, which is called ANRs. And we're also utilizing ethnic media channels for briefings as well as interviews. Back to you, Jill.
Thank you, Bonnie. So just as a reminder that the slide deck is going to be posted on the Adult Expansion webpage, as well as this recording. Additionally, we will be sending out the slide deck to all participants via email after the webinar. So next up, we have user testing and findings. So ensuring clarity and accessibility in our outreach materials and tailoring them to match our audience's needs is our foremost goal, and it's to develop resources that are clear, concise, and easily comprehensible for everyone, no matter their background or language proficiency. By carefully monitoring the reception of our outreach materials, we can gain valuable insight into the user experience. This feedback is fundamental in our ongoing efforts to improve and provide more user-friendly content. Another pivotal aspect of our mission is to identify any potential barriers or concerns that might hinder individuals from engaging with the Medi-Cal program. We acknowledge that our audience's needs are diverse, and by identifying these barriers, we can work towards breaking them down and making our program more accessible. One of our core strategies is to tailor our outreach efforts to align with the specific needs and preferences of our target audience. This strategy is not just about reaching as many people as possible, but about reaching them in the most effective, meaningful way. Our work here is not just about communication, it's about connection. And with these strategies, we aim to foster a sense of unity and understanding among all of our Medi-Cal members. So the evaluation of our outreach materials was done through rigorous testing and feedback collection. Our partner, GMMB, has played a pivotal role in this process. They conducted a comprehensive analysis, testing both the content and the design aspects of our flyers and first notice. An integral part of this process was the involvement of 11 ambassadors. They participated in virtual interviews with GMMB, providing invaluable feedback on the flyers and notice. This group included individuals facing and not facing membership, offering a diverse range of perspectives. To further enhance the relevance and effectiveness of our materials, we extended our feedback collection process to the communities we serve. 5 of our community partners facilitated an in-person, in-language interviews with members of our target audience. These interviews provided feedback on both the flyer and the first notice letter. The languages utilized for these interviews were Spanish, Chinese, Korean, Vietnamese, Mixteco, and Russian. And this represented the linguistic diversity of our California population. This thorough investigation gave us a deeper understanding of our audience needs and preferences. Our goal is not just to provide information, but to ensure it is understood and well received. This process helps us achieve that and is instrumental in creating an effective, well-tailored communication strategy. So some key learnings that we found from our user testing: people are happy about the expansion. Community assistance is is vital to explain the process and assist with forms and troubleshoot services. Many appreciated the reassurance that Medi-Cal is not considered part of the public charge determination. People are more likely to seek help from trusted organization and community members than their local Medi-Cal office. So some other topics that we learned are the importance of including the full list of Medi-Cal services. The content should be clearly organized, ideally in bullets and easy to read. Phone numbers are critical. The state seal adds legitimacy. The QR code and the URL are very helpful. And the request was to use ethnicity-specific photos rather than animations on materials, and that the next step should be clearly outlined. And just as a note here, the flyer that you see on the screen is under revision to present more evergreen language for all California's post-implementation. So post January 1, 2024, our outreach is going to be focused on covering, making sure that the language is for all ages instead of calling out that 26 through 49 population. So next up, we have the navigators. I'm going to hand it over to Nancy.
Thank you, Jillian. Good morning. My name is Nancy Ojeda. I'm the unit manager for the Health Navigators project. And today I'm just going to share some details regarding how the Navigators partners are assisting with the outreach and enrollment for the adult expansion. So the project partners for the Navigators Health Enrollment project are kept apprised of the toolkits that are developed and posted by DHCS. We continue to review materials and information and notify our partners of the information and tools available for use. We also make sure that the Navigator project partners are provided with the outreach material and the most up-to-date information, and remind partners that the information and materials are available for modification and local tailoring, for tailoring for their local efforts as needed. Next slide, please. Additionally, our Navigator project partners have been participating in community events, again, in the effort to provide that direct outreach and enrollment service for the adult expansion. The community events are either directly hosted by our partners or they are participating in a pre-established event. Some of those events do consist of local food distribution sites, places of worship, school campuses, swap meets, farmer markets, community centers. Some partners are actually out in the farms and the fields, health fairs, public events, movie theaters, grocery stores, panaderias, and they do leverage social media. Thank you. While partners do have the capacity to offer services in various languages, some of the languages identified as by our partners as targeting are English, Spanish, Mandarin, Cantonese, Tagalog, Vietnamese, Farsi, Cambodian, Korean, Mixteco, Russian, Arabic, Chinese, and Hmong. For more information regarding the Health Enrollment Navigators project, please visit our website where we have public-facing information, resources, and other toolkits that all entities, whether or not you're a partner, can access and leverage. We also have a new tab where we are posting local partner events, and we keep that up to date. It's for serves as a centralized source for events and routine community resources, as well as spreading the word and information regarding the Navigators project. We currently are listing December and January events. And lastly, in an effort to answer questions about partners and their targeted efforts, we wanted to share that earlier this year, the advocate community did share with us demographics broken down by county. And as such, we provided all that information to the partners so that they could reference and utilize as needed. We continue to encourage partners to add services and in other languages when possible. And we remind partners that they can adjust their line items with their existing budgets and work plans in order to fit the community needs. And that is all for me. Thank you.
Thank you, Nancy. So next up, we have some resources. So here's a link to the adult expansion webpage. As I mentioned earlier, this slide deck will be provided after the webinar via email and will also be posted on the adult expansion webpage. Here's a link to the ACWDL 2308, and that provides policy guidance on the expansion. And then we also included the link here to learn more about public charge. It's the California Health and Human Services Agency Public Charge Guide. And so it's important to post resources in an accessible location. So we post all of our outreach materials on specific coverage ambassador web pages, and we have all of the links here. This includes the ambassador sign-up page, the Medi-Cal continuous coverage requirement unwinding and renewal toolkit, Keep Your Community Covered Resource Hub, the Get Medi-Cal Resource Hub, and this has the specific adult expansion outreach assets. We've also created Medi-Cal member-facing web pages, as Bonnie had discussed earlier, and this is the Get or Keep Your Medi-Cal coverage, and then I have the link here for the English landing page as well as the Spanish landing page. So for any questions after this webinar, you can email adultexpansion@dhcs.ca.gov or myself at jillian.davis@dhcs.ca.gov. So we do have quite a bit of time here, so I'm going to go into the Q&A and answer some questions. So we have a question about the $700K estimate that I had discussed earlier. And the question is, how many are in the new enrollee population versus the transition population? We do not know the differences in those populations yet. In April, we will have kind of that real data where we can see that transition population for January. We do a 90-day look back when we look at our data. So that is why, you know, it'll be in April whenever we can really see that true January transition population. This data will be shared, posted on the DHCS Open Data Portal quarterly, and like I said, beginning in April. I have a question about the link to the newsflash and bulletin. I can include that in the email that I send out after the webinar that includes this slide deck. Question on how do we identify the new enrollees for the second notice? So those new enrollees are those people who are part of the transition population and or those people who are new applicants. So those, whenever they're new applicants, whenever their eligibility is established, that is how they are identified and send that notice of action. For the transitioning group, whenever they transition to full scope, that triggers that notice to go out. A question about homeless individuals and people who do not receive the transitioning information. Should they go into the office to complete forms? So there are no forms to complete. It is an automatic transition. If they do have a renewal due, they do need to complete their renewal. However, there's no action needed for individuals to transition to full scope. They will automatically transition January of 2024. For non-coast counties, they must complete the choice form. Is there an online option to make a choice? Angelique, are you able to speak to that?
I'm sorry, can you repeat the question?
Yes. The choice form. The question is there an online option to make a choice for the non-coast counties? Or do they have to complete the actual?
I would have to take that back. I don't know off the top of my head. It might be different for a brand new enrollee in full scope Medi-Cal versus someone who's like looking to change plans and stuff like on the HCO website. So I can take that back.
Yes, no problem. And as I also mentioned at the beginning of the webinar, this Q&A, any questions that we're taking back, we will create a Q&A log and provide that out to all of the participants. Question on what type of documentation is required for applicants to establish California residency, and will the application for new enrollees require any type of immigration documents? So when somebody completes an application, they attest to California residency. The county may ask for verification if for some reason they have conflicting information. And common ways to verify that would be a California ID or like a rental agreement, something showing that you have residency in California. So for the immigration documents required, it depends on the status that they're claiming. If they are not claiming a satisfactory immigration status, there's no documentation required. What is the earliest somebody can apply now for full scope Medi-Cal starting in January 2024? Can they apply in December and get approved for January? Yes, we encourage everybody to apply now. As I mentioned, we have that transition population. So if they apply now, they would receive the restricted scope Medi-Cal for December, and then they would automatically transition in January to full scope. We have a question here, why would somebody stay in restricted scope after the expansion? So restricted scope based on immigration status will no longer be a thing starting in January of 2024. There is a difference between restricted scope and limited scope. So there are limited scope benefits that have nothing to do with immigration status. For example, the TB program or DCC TP services, those aid codes will still be in existence because those are limited scope programs. But as far as restricted scope, as I said, that will no longer be in effect beginning January 1, 2024.
Hey, Jill, really quickly, I did find the answer to that question. So I'm going to confirm that the transitioning adult expansion population will be able to go online to the healthcare options website and make their plan selection starting this month. And the choice packet does tell them that they have that option.
Perfect, thank you. And that kind of, we have a question that just said, can patients already enroll on the HCO website, or do they have to wait until January 1st? So yes, as soon as they are conferred that eligibility, which we are doing now with those transition batches, they can go on the HCO website and complete their choice. Okay. Great question. Will clients be issued ID cards, or will they still use the same ID cards provided with limited coverage? So they will not be issued new Medi-Cal beneficiary cards. However, if they are now going to move into a managed care plan, they will receive the managed care cards that they will need to use. For new members, how can they apply and where? So they can apply through benefitscal.com. They can apply through Covered California. They can contact their local county office. On the adult expansion webpage, they can also find other resources for how to apply, which include the beneficiary center phone number. They can go online and download the application. So it's just the same way that they would apply for Medi-Cal today. There's no specific way to apply for this expansion. How long does someone have to be a California resident when they've moved from another state to be eligible to qualify for Medi-Cal? There is no specific time. If they have established California residency, they can apply and meet that residency requirement. Question about crew call. Would we change their form for crew call for those who have already claimed crew call in the past? So if somebody has claimed crew call, that means they are already getting full scope today and they are not part of this expansion. You do not need to have them change anything. They are already getting full scope benefits, and so they are good. Somebody asked about somebody who's 77, if they would be eligible. So this expansion is the 26 through 49. If somebody is 50 or over or under 26, they are already eligible for full scope today, regardless of immigration status. So yes, somebody who's 77 would already be eligible for full scope benefits today and do not need to wait until January for those full scope benefits to take effect. Do transition populations automatically get enrolled into full scope? For those new applicants, they will not get enrolled automatically, right? So transition populations are automatically getting transitioned into full scope. If somebody comes in and applies, they would also be granted that full scope Medi-Cal beginning January of 2024 when they establish eligibility. I'm hoping maybe you can answer this, Angelique. Can different family members have different healthcare managed programs? Some sure different managed care plans?
I believe so, just based on the information I shared a little bit ago, that they will be default enrolled into the same plan if they're in the same household, unless an active choice is made otherwise. So yes, I believe members in the same household can have different, be enrolled in different managed care plans.
Yes, and I just thought about this. So something that we do see is children who are going away to college and they are in a different county than their parents, of where they're going to school, and they may not have a certain choice, that they had in their original county. So I do know that they can have separate plans. So that sounds right. Thank you.
Thanks.
So somebody was asking about those limited scope programs that I was mentioning earlier, and I did mention the TB and the BCC-TB. So TB is the tuberculosis program, which is a limited scope program for TB patients. The other one I mentioned was breast and cervical cancer treatment program. So those services are specific to the breast and cervical cancer treatment. For newly legal permanent residents, is there still a waiting period? No, there's not a waiting period in California. If you have not met your 5-year bar yet, you are still eligible for full scope. We provide state-funded full scope for them. If an undocumented person is over the income limits for Medi-Cal, would they still qualify for full scope Medi-Cal? They could qualify for full scope Medi-Cal with a share of cost. Sorry, I'm just going through these. A lot of these we've already answered, so they're kind of just duplicates here. Does Medi-Cal affect clients who may have permanent residency and are looking forward to citizenship? No, as I mentioned, that Medi-Cal is not considered in the public charge termination, so receiving medical benefits would not impact their citizenship. If a patient applying for Medi-Cal is turning 26 in 2 months, he will receive restricted scope Medi-Cal until he turns 26. So no, as I mentioned just a little bit ago, everybody who is under 26 is already eligible for full scope today. So if they apply today, they would be, and they're under 26, they would be determined eligible for full scope today. And then when they turn 26, they would just continue in their full scope coverage. Will current cancer or chronic diagnosis hinder eligibility? No, Medi-Cal does not look at any of your healthcare information to determine eligibility. Will clients need to have linkage, or is it open to all eligible, or is it open to all to be eligible? There is no linkage required for this expansion. It is open to everyone who applies. Okay, well, that is all that I have in the Q&A. There were some other questions that I'm going to have to take back. They're just outside of our program area here, and those are more specific to non-MAGI assets, income type of questions. So I will take that back to our other partners within DHCS and provide those that information back on the Q&A log. For an undocumented individual who gets paid in cash or is self-employed, can they use that as their proof of income? Yes, they can. They are able to attest to their income. There's also other ways that they can provide proof of the income. They can work with their local county office on how to verify that. Will plan selections done after December 15th have an effective date of January 1 or February 1st? I believe that is February 1st. Angelique, do you happen to know the cutoff date for plan selection in order to be effective January 1?
I believe it's printed in the choice packet. I believe it's December 19th, but I'm not 100% sure, but it is printed in the choice packets. And then if they don't select by the date printed in their choice packet, oh, actually, give me 1 second. I just got a note that it is December 22nd. The cutoff is for plan selection is December 22nd for January 1st enrollment. And then if I believe if not selected, then they default into whatever plan is printed on their choice packet on February 1st.
Perfect. Thank you.
Mhm.
I do have another question about crew call and not applying it anymore. Just enrolling people into Medi-Cal, and they will receive restricted Medi-Cal until 1/1/2024. If somebody does claim crew call today, they would be eligible for full scope. So if somebody does come in and they claim it, you would want to get them enrolled into those benefits right away, because as mentioned, the expansion doesn't go in until January 1st. So they would receive those full scope benefits now. Question on undocumented individuals. Are they required to file taxes as in the covered California requirements? It would all depend on their household information. There is no requirement to file taxes for Medi-Cal eligibility. However, the income that is used is determined on the tax household. Okay, that looks like we've gotten to everything. So once again, this recording will be posted on the Adult Expansion webpage. The slide deck will also be provided after the webinar, and it will also be posted on the Adult Expansion webpage. This is a very exciting initiative, kind of wrapping up our entire population. This is our last group to transition to full scope regardless of immigration status. Really grateful to all of our community partners. We could not have a successful implementation without you all. And if you have any further questions, you can reach out to me directly or the adult expansion at dhcs.ca.gov inbox. Thank you for joining, and everybody have a wonderful rest of your day.